Well, good afternoon, my friends. It is a time for us to share in another opportunity for the Flint Community Webinar on Coronavirus. I'm your moderator today, Yvonne Lewis, and it has been my delight and yet a challenge because of the issue that we're dealing with to moderate these 52 weeks of this webinar. It is amazing how far we have come, and yet we all know, based upon even our previous conversation, we've got a long way to go. We want to remind you, and thank you all for joining us through the webinar, but we want to remind you that you can join us on Facebook, and please encourage friends that you may know to join us. We have an amazing session for you today, so we really want you to stay here with us. In appreciation to the 52 weeks of partnership, we're going to provide for you a glimpse back what's happened in these last 52 weeks. And this is a tribute and a testament to all of us and the work that's been done to bring credible information to our community. Good afternoon, and thank you for joining us this afternoon for this very important webinar. My name is Yvonne Lewis. I'm the co-director of the Health Flint Research Coordinating Center, outreach director for the Genesee Health Plan. And on behalf of the Healthy Flint Research Coordinating Center and our partners, we again welcome you to participate in this webinar. Thank you for joining our webinar today. This is the fourth in our series. We'd like to welcome you to the 9th webinar. It's been our privilege every week for the last 17 weeks to join you in a conversation around what's happening in our community. As you can see, this is week 22. And we appreciate you so much for joining us. Greet this wonderful panel who has joined us for our 28th Flint Community Webinar on Coronavirus. This is week 32. I want to let you know that it has been 45 weeks now, 45 weeks of an amazing partnership. It is the 51st webinar. I'm your moderator today, Yvonne Lewis. I'm so excited about where we are today in all of 51 weeks that we have been able to come to you with information.
Under attack by the COVID virus. This is what it targets. And why that's so important is because the surface of the little sac is very thin.
Okay, so I want to just show my folks real quick. This is how you put on gloves. I'm going to show you how to actually use your personal protective equipment. First thing, before you put your gloves on, let me turn my background off. First thing to do, you wash your hands. Most people don't know this. The point is to put a clean hand in the glove.
Personal hygiene and home sanitation, and that is the foundation on which we build. Stay home, stay safe is still the mantra.
Now, for what you've all been waiting for, U.S. Representative Congressman Dan Kildee. Dan, it's so exciting to see your face actually. And I want you to know one of the big questions our community has is, so how are you?
Well, that's a good question. I'm better every day. I'm okay. And so I think we have to make sure we don't fall into a trap of believing, well, on one side you have this group and on the other side you have that group, and we all need to find a way to come together. We come together, we reconcile when there's an acceptance of truth. You can't have reconciliation without truth. Otherwise, it perpetuates the lie. You can't have a false, counterfeit reconciliation with people who still cling to a fantasy that is just pure concoction.
We want to welcome to Flint via the HFRCC webinar on this very important issue, Dr. Reverend Todd Yeary.
Good afternoon, everyone, and thank you, Yvonne, and Dr. Deborah Farholden, and to your colleagues for this opportunity to share with you on today. We're going to actually do a disservice to communities that are often at the highest risk and most vulnerable to systemic abuses that actually affect our ability to cope. So with that, let me just kind of talk to you about this notion of the role of religion and spirituality when dealing with African American communities in crisis.
We have been here now 52 weeks, and it is it's really breathtaking at times to think about what's happened in these last 52 weeks. I'm going to ask us to just take a moment of silence to think about as we reflect. In this nation alone, we've lost over 500,000 souls. But that's not at all indicative of the number across this world that we've lost, because we've talked about this being a global pandemic. Everywhere in the world, there was an impact. And so we have had this opportunity to join together for these last 52 weeks to think about what the impact is for us locally as well as globally. So I do want to offer this opportunity for us to just think about those who have lost their lives to this pandemic. In some cases, in their losing their lives, they've helped us to learn so much about the pandemic. So let's not let their lives be in vain, but let's continue to learn lessons that we can improve upon. So let's take a moment of silence. Thank you. Thank you all. And as we continue this webinar today, there's some really important concepts that we want to think about. I want to invite Dr. Reynolds and Dr. Wolford to join me in a conversation. We have our guest here, Dr. Paul Kilgore. I want to say he's back by popular demand. He gave so much information last week. He was requested to come back again this week. But just knowing what's happened in these last 52 weeks, we didn't know anything or much about the coronavirus as we know it today. So I want to ask you, Dr. Reynolds, if you could help us get a little bit of sense about this from some information you shared earlier about even not just the virus, but the vaccine and where our thinking is in this nation around, particularly even here in Flint, Genesee County.
Well, I'll start off by saying this year has been a humbling experience. I thought sometimes I was being attentive and having people share their sense of grief and loss, because we're not just talking about the people who have died, but we're also talking about the families who have suffered one loss after another. And so, now we are getting an arsenal of tools to push back against the spread of this virus. And you've heard people talk about vaccine hesitancy. And, I've kind of hinted that I can't accept that term. And I think our other speakers have said similar things. There are people who have questions. And it's been tagged on the African-American community that we're so vaccine hesitant. And I just stumbled across last night on NPR, a Marist NPR survey, which said, among those who responded to the survey, 73% of Black people and 70% of white people said they either planned to get coronavirus vaccine or had done so already. 25% of Black respondents and 28% of white respondents said they did not plan to get a shot. Latino respondents were slightly more likely to say they would not get vaccinated at 37%. You heard the word slightly, right? Mm-hmm. Compared to 63% who either had or intended to get a vaccine. And for some communities, just to show up at a vaccine station without ID or the proper documentation can be a problem. And I hate to get into the subject, but ICE has enforcement power within 100 miles of any international border. Does that remind you? Do you think we live near a border? Well, the whole state of Michigan is a border state. So some of that hesitancy is due to thinking about your situation and your family. But the main point here is, I think the hesitancy idea has been overhyped. And yes, there may be some sectors that we have to pay attention to, especially our young people. But the problem is access. People want it, but can they get it? And we're seeing some hopeful signs about access.
Yeah, I think we're going to learn some more about access issues this afternoon in our webinar. And Dr. Deb, you're here with us too. You know, you always have us that epidemiological, that overview of what the numbers say and what they really mean. And this whole notion of people wanting it, not being able to get it. But you always talk about equity. So how do we get to that in this conversation?
To me, equity is just fair play. Equity is about those that are eligible having fair and equitable access. And I will tell you, I was a little disheartened with the president's comments that on May 1, we're going to open up eligibility to everybody. As a niece to a 66-year-old uncle with COPD who's been stuck in the bottleneck of the wait list, I just worry that opening up eligibility without making sure that those who are most vulnerable among us. I think the categories that we created were absolutely brilliant. We prioritized people who were at greatest risk of exposure and people who were at greatest risk for poor outcomes. Until all of those people that want the vaccine have gotten it, I do not think that we need to open it up to the population at large. We need to ensure that those at most at risk for exposure and a bad outcome are first in line. And so I am a demand that we mandate equity, that we make sure that the people who need it the most get it first. And everybody else, wait your turn and do what Dr. Reynolds said. Continue to honor the protocols. What do you do before your vaccine? You wear your mask, you wash your hands, you watch your distance, your density, and your duration at gatherings. What do you do after the vaccine? You wash your hands, you wear your mask, you watch your density, distance, and duration in gatherings. So that's my push. I want to make sure that those who need it the most are first in line.
Thank you, Dr. Deborah. Now, Dr. Kilgore is going to give us a host of information afterward, but I did want to give him a quick opportunity here because I see him nodding his head about the conversation about vaccine availability and then understanding the different types of vaccines. So, Dr. Kilgore, just a quick word that you wanted to share in this roundtable segment.
Well, it's a great point that Dr. Holden mentioned. And, you know, one of the things that's really interesting about the way access has evolved for the vaccines is that we knew that Pfizer was available first, that rolled out, then subsequently Moderna was approved. And now we have the third vaccine, the one-dose J&J vaccine, which is now scaling up. It's not as widely available as the other two, but we're seeing more places getting that out. I get daily calls from individuals in the community who are wondering, how do I get access to a vaccine appointment? And they often don't have a computer. And so the options that I explain to folks are number one, call the local health department by phone. Number two, call your local pharmacy. It could be a CVS, a Rite Aid, a Walgreens, a Meijer. They all are starting to do vaccinations in the community. And then thirdly, if there's a hospital or health system near you, call the hospital and health system and ask them how you can begin that registration process to do it over the phone.
Thank you, Dr. Kilgore. And I see Sherelle. Sherelle, we're going to get you. She's going to tell us how we make that happen right here in Flint, Genesee County. And she's going to be up for us in a minute from the health department. Well, before we get to you, Sherelle, I want you got a quick one. You got a quick word in there you want to put in right now, or you're going to hold it all to, there you go.
Well, I would like to iterate that you can schedule an appointment by calling, if you don't have internet access, the health department at the phone number 810-424-4443.
Thank you. And I know you're going to share some more with us in a moment. Thank you so much. Get that in right now. You know the phone. If you want to call them right while we're on the webinar, you can do that. Dr. Wolford, I got a couple minutes now for you. You always do these wonderful illustrations for us to help us understand what all of the science means behind the virus. And so as we prepare to close this roundtable, can you just give us a couple of those nuggets that you often share?
Well, thank you so much, Yvonne. As I think back about what we know now versus what we knew
52 weeks ago, we've clearly learned a lot, right? 52 weeks ago, we knew very little about this specific virus. We were learning, but we knew that we had to keep our immune systems in tip-top condition because that was pretty much what we had to rely on. And now 52 weeks later, we know a lot more. We know, praise the Lord, that we have vaccines that are available that can help protect us. We know about keeping our distance and washing our hands and all of those types of things, but we still are in a position where we're learning more and more about the importance of our immune system. So I just wanted to mention something on that topic because later on, I believe Dr. Kilgore is going to speak a bit about how the vaccine attacks us through our nasal passages, the receptors there, the way in which it attaches to little cells there and gets into our lungs. And then when it has a really bad, as we know now, coronavirus often has two phases. The first phase is the outpatient, not so bad. And then all of a sudden it has this rapid turn for the worst. And that rapid turn for the worst is when the immune system that should protect us starts working too hard and damages us instead. I normally, I like my fruit basket, but this time we're not going to do a fruit basket. If I'm going to put sugar in my recipe, if I put a couple teaspoons, lovely, it will taste great. If I dump the whole box into my coffee, sickly, can't eat it. And that's sort of what happens with the immune system. At first, it's working well. We want it to work really well. Then this virus causes it to overreact. And that causes a lot of the damage that we see. So one of the things that I think has come out to me over the past year is the importance of our immune system, is the importance of keeping it healthy. And so the one thing I'm going to mention about the fruit that I love to talk about, putting the healthiest things we can in our bodies, putting in those fruits and vegetables, drinking that water, getting the exercise, keeping stress down, doing what we can to keep our immune system healthy is one of the things that will help to protect us, even when we get the vaccine. And I hate to say it, when the next thing comes along that we'll have to deal with.
Thank you, Dr. Wolford. And let me thank our panel, Dr. Deborah Holden, Dr. Paul Kilgore, our Dr. Lawrence Reynolds, and Sherelle. Thank you so much for helping us get this conversation started today. And we look forward to hearing it from a couple of you in a few moments. So we want to shift now to hear from Gary Jones. We have been fortunate during this webinar to have his voice come directly from the governor's office to give us those updates. So Gary, tell us today where we are with messages from the governor's office.
Yep, thanks, Yvonne. Yep, so the governor today announced that an 8-week mass vaccination site with the capacity to administer 6,000 doses each day will open on March 24th at Ford Field in Detroit to serve residents in the broader Southeast Michigan region. The Biden administration, in partnership with the Federal Emergency Management Agency, or FEMA, selected Southeast Michigan for this major new community vaccination site. The vaccine will be offered at no cost, and insurance is not required, nor will it be requested at the vaccination center. Any Michigan resident who is currently eligible to receive the vaccine under MDHHS vaccine prioritization guidance will be able to register for an appointment. The site is not yet taking reservations, but specific instructions on how to book an appointment will be announced in the coming days. Michigan will be expanding access to the vaccine to Michiganders ages 16 and older with medical conditions and disabilities starting March 22nd, and all Michiganders age 16 and up to become eligible on April 5th. And the governor also earlier this week, signed legislation that supports the COVID-19 recovery plan she sent to the legislature in January. It includes key provisions of the governor's My COVID Recovery Plan, including a $2.25 hour wage increase for direct care workers, $283 million in federal emergency rental assistance, and up to $110 million in federal funding for vaccine administration, and up to $555 million in federal funding for testing and tracing. The state budget director also sent a letter to the appropriations chair, Representative Thomas Albert, and in the Senate, Representative Jim Stamas, asking again for a joint meeting no later than today, March 12th, where formal negotiations can occur with the goal of getting the remaining more than $2 billion in federal funding appropriated. The governor proposed fully allocating $622 million for rent and utility assistance, but the legislature only provided $283 million, thus withholding $339 that was meant to keep families safely in their homes. And the governor also proposed fully allocating $2.7 billion to help residents feed their families, but the legislature only provided $600 million, thus withholding $2.1 billion in food assistance through the Federal Supplemental Nutrition Assistance Program, or SNAP, as most of us know it. And finally, always like to plug the websites, michigan.gov/COVID vaccine, best website to keep up with all updates pertaining to the vaccine in Michigan, and michigan.gov/coronavirus is still the best catch-all website.
Thank you so much, and I do know we need to make sure we stay in touch because you're giving out some tremendous information that will hopefully be seen real soon in the impact in our community. So thank you. Back by popular demand is Dr. Kilgore. You heard a little bit from him. Dr. Kilgore, we had more questions about the vaccine, about the difference in the vaccine trials. So please help us to get even more clarity about the vaccines. And then you also shared the impact, the long-term impact. You use this term long haulers. Help us to understand this better as well. Dr. Kilgore.
Thank you very much, Yvonne. I'm going to go ahead and put some slides up if that's okay.
Sure, yes.
Okay, fantastic. Okay, so let's go ahead and get right into it. This week there's a lot happening, a lot of good news potentially, and I'm going to save that for about the middle of the talk right now. So let me go ahead and share my slides. Yvonne, can you see my slides now?
Yes, we were able to see them.
And now,
back
now
up.
Are you seeing the full screen?
We saw the full screen at first. We had them loaded for you.
Let me see.
We had them loaded for you.
Oh, you do? Okay, I'm sorry.
Yes. So if we could go back and our tech will share the screen.
Oh, okay, fantastic. Thank you.
Yes, go to the next slide, please, Tay.
Thank you.
Thank you. Yeah, there you go.
Terrific. Okay, and then let's go to the next slide too. So one of the things that we know very well is since the very beginning of the pandemic, we have seen hundreds of thousands of people put in the hospital, hundreds of thousands of people put in intensive care units, and we have now clearly identified long-term complications as people recover from COVID-19. One of the things that I just found, and you probably have heard updated from the CDC website, is that the risk. Are we okay? Can you see everything?
Yes,
okay.
We're good. Thank you.
Oh, okay. Is that the risk of serious disease among African American is actually 2.9 times greater than white Americans. The risk of serious disease comes for many different reasons. There's a new paper that just came out now showing that the risk of disease transmission is even more pronounced in circumstances where there's pronounced household crowding. And if you look at the American Crowding Index for households, that's defined as about 1.5 people per habitable room. So we have a serious problem in many households across this country, and that really has not been talked about widely at the national level. So let's go to the next slide. One of the things I frequently get asked is, are the vaccines safe? And the fact of the matter is that when we have conducted the trials in the Detroit area, we've included a large proportion of African-American participants. Our site in Detroit has enrolled folks for the Moderna trial, and we've just completed the Johnson & Johnson 1-dose trial. We are now doing a 2-dose Johnson & Johnson vaccine trial. That's going on right now. And if you want more information about that, I'm happy to provide that. So millions of people in the United States and around the world now have begun to receive the Pfizer, Moderna, and now J&J vaccines, the reactions that we see with these three vaccines are actually quite similar. And locally, when we see reactions, we see pain or discomfort at the injection site. That happens with the first dose of Pfizer and Moderna. It happens with the second dose of Pfizer and Moderna as well. We'll talk about that. The systemic signs I'll talk about in just a minute are very similar among the three vaccines as well. So fatigue, headache, generalized ill feeling or malaise, and very few people, relatively speaking, get things like fever or other side effects or adverse events. So that's really good news. The similarity of these vaccines is really pronounced. One of the reasons why we see these vaccines being safe, and for the next slide, I'll just highlight a couple things. I frequently am asked, and we talk about the rapidity, the speed at which these vaccines were developed. So it's true, it was faster than ever before. But if you focus on the lower part of the slide here where my pointer is, you can see actually that the clinical trials in humans were overlapping. One of the reasons we could do that is that when the FDA and the manufacturers talked with each other, it was known that these vaccines were going to be expedited. So the manufacturers actually, before they started enrolling people, were beginning to write all 3 phase protocols. In other words, the procedures and the steps to enroll people in a phase 1 trial, phase 2, and phase 3, these were prepared in the early part of 2020, even as the animal studies were going on. So there's a lot of simultaneous work going on, whereas in the past, in older days of vaccine development, we never did that. And we didn't do it because we didn't have to. And I'll tell you one other key reason, which sometimes people forget. The reason we're able to develop these vaccines so fast is that we had money to pay for all of the vaccine trial work from the very beginning. When manufacturers decide about a vaccine, they make a very deliberate decision. And it's based on the quality of the data, how the vaccine performs in phase 1 and 2. If these trial results look good, then the manufacturer will talk with the CEO and they'll get the research team and figure out if they should move on to the next phase of study. That happened, but it happened also knowing that the government, the federal government, would provide money. So that was important, very important factor. We don't have that normally with all vaccines. And then finally, I need to tell you, when we enroll people in our trial, when you're a participant in our trial, you're actually using your smartphone to talk with us. You're using a computer to actually enter your data. We have all computers controlling the data that we have in the trial. And the only paper form that we actually have is the informed consent form. And that speeds it up too, because we can process the data much faster, analyze the data much faster. So that's how we can actually speed up vaccine development. I think you're going to see that going forward for the many, many years to come. Next slide, please. So I won't spend too much time on this, but I did want to point out we have 3 general types of vaccines shown here. Type 1 is the mRNA vaccine, Pfizer, Moderna. Type 2 is a recombinant SARS coronavirus surface protein. That's really a vaccine you haven't heard much about yet. It's called the Novavax vaccine. That's in phase 3 trials right now. And then the type 3 vaccine is like the Johnson & Johnson vaccine. This is an adenovirus, and I'll show you this in just a second. But one thing point out in the yellow script down here, we know now very clearly that these 3 vaccines, and the other vaccines as well, induce B cell and T cell immunity, 2 arms of your immune system operating simultaneously to protect you. It's one reason why we can get long-term protection after you get vaccinated. Next slide, please. The vaccines that are approved by the FDA and now recommended by the CDC and ACIP, the Advisory Committee on Immunization Practices, that's the Pfizer, Moderna, and Johnson & Johnson. All these vaccines have gone through phase 3 trials. And now we have AstraZeneca, it's completed phase 3 trials. Novavax has completed some phase 1 and 2 trials. They're getting into phase 3, completing it soon. And that's looking to be very good as well, even against the variants. And we'll talk about that, I hope, down the road here. Next slide. The Johnson & Johnson vaccine, if you want to know the formal name, it's ad26.cov2.s. It just stands for adenovirus 26. It's one type of human adenovirus that we use as a vehicle to package the DNA that has this code to make the spike protein. That's the only thing this vaccine does. It's the only thing that the Moderna vaccine does, the only thing that the Pfizer vaccine does. They actually help you make a spike protein and you make antibody to that. Now, the Johnson & Johnson vaccine is very efficacious, 85% against severe disease, 72% against all types of disease, even mild disease included in that estimate. And that's in US volunteers as well. 66 globally, that's because it's including residents from South Africa where they have the South African variant. I won't spend much time on this, but the bottom line is that the J&J vaccine was so convincing in the data that was presented in the FDA committee that it was a unanimous vote, 22-0. And immediately, 2 days later, the CDC ACIP committee recommended immediate use of the vaccine. Next slide. A very high efficacy for the J&J vaccine. You see that at day 14, even 2 weeks after vaccination, you have some protection. About 4 weeks later, you have 85% protection, and that's with one dose of the vaccine. That's incredible. Next slide. It is efficacious in these subgroups, so younger people, it's efficacious, and I'll just point to you this column here. This shows you that dot, that's the point estimate. That corresponds to, for example, 68.8 for non-Hispanic Latino group. But you can see the overlapping bars. That means the confidence intervals are overlapping, meaning there's no statistically significant difference among these estimates in the subgroups. The bottom line from this slide is that when we look at the subgroups, it's protective. And you can see we have data in the African-American population as well, 68.6% overall. And the good news is that when you look at more severe disease, leading to hospitalization like ICU stay or even death, it's even more protective. Next slide. The adverse events I mentioned already, injection site pain is the most common one. Erythema, redness, and some swelling does occur, but it's relatively rare, as you can see here. Next slide. And then systemically, I mentioned the fatigue, headache, muscle aches, nausea are the most common adverse events we see. There are some other rare ones that occur, and we can talk about them in the break as well. And next slide. So summary, we have 2 mRNA vaccines. We have the one-dose non-replicating adenovirus J&J vaccine. All underwent very intensive preclinical evaluations in the laboratory, including animal testing. All underwent human phase 1, 2, and 3 trials in very diverse populations, including thousands of people in the US. Next slide. The J&J vaccine is making protective antibody against the spike protein. It cannot cause disease. It does not change your cell's DNA. That does not happen in any way, shape, or form with this vaccine. Same goes for the mRNA vaccines. It does not change any part of your DNA. Then the safety profile for the J&J, I also want to point out, looks very similar to these other 2 vaccines that we already have in approval and being used. Next slide. So just quickly, let me point out the Pfizer and Moderna are most widely distributed in Michigan. The J&J just started last week, so that's going to be ramping up quickly. And you can see it's given by hospitals, health departments, pharmacies as well. But we have now 2.83 million doses administered in Michigan, so that's quite impressive. And next slide. And then you can see here the differences by gender and race. We have a long way to go. We definitely have a long way to go in Michigan. Even though it sounds like there's a lot of vaccine that's been given out, we still have enormous work to do, particularly in hard to reach areas, hard to reach populations where they don't have transportation, they don't have access, they don't have computers, and they may even be afraid to leave the house. So we need to do a lot more outreach than what we're doing. Next slide. So I'm worried because we're now moving into a plateau phase in the US case count. It's just leveled out. At the same time, the projection, if we go out to July, we're looking at over 600,000 deaths still. The bottom line, the reason I'm showing you this slide is that if you had any reason not to get a vaccine, I can tell you now, looking at this slide is one of the best reasons to get a vaccine. There's no doubt in my mind, if you look at the case counts from CDC, it's around 53,000 cases every day still due to this disease in the United States. The risk is there, and this does not necessarily take into account the new variants that are happening and spreading. They're in Michigan. We know we have the variants here in Michigan. They are being detected. They're moving rapidly. They're more transmissible. They can cause more severe disease. It is absolutely crucial. If you've even thought a little bit of hesitancy, now is the time to talk with your friends, your family, ask the questions you need to ask, talk with me, talk with anyone you want that you trust, and get the information, and then go ahead and sign up for that vaccine appointment. That's the best thing I can say right now, and then we'll go to the last slide. So these are great vaccines as we see them right now. We're tracking the safety data very carefully. Personally, I would be very comfortable with any one of my family members, friends, neighbors, family, contacts, coworkers getting any one of these vaccines. They perform very similarly. The good news I wanted to point out to you just came in the past 24 to 48 hours. There's a publication suggesting that the Pfizer vaccine, and likely Moderna too, prevents asymptomatic infection. This is very, very good news. And then the other data that's come out from the New England Journal of Medicine suggests that if you have had COVID-19 in the past, you've had disease, you may only need one dose to get the level of protection that's really needed to prevent further serious disease. That's really good news because it means a lot more vaccine may be available. Stay tuned to see if the CDC and other groups start looking at that data and saying, if you've had COVID-19 in the past, look, you only need to have one dose. So that's good news. And so I happy to answer any questions. I'm here, and thank you so much, everyone, for the opportunity to be here with you today. Thank you.
Thank you so much, Dr. Kilgore, because you have answered some really important questions for us. And it's good to hear that there's consideration being given to all of the individuals that may have some challenges getting to even the access points that are available. And so you mentioned, I just want to re-emphasize, you mentioned the fact that the Johnson & Johnson is not yet available in our community. So you're encouraging that if the opportunity presents itself, these others are equally available and provide the protection that one might need.
Absolutely, that's true. A frequent question I get is if I get the J&J vaccine or I get Moderna or Pfizer as dose 1, can I get the other vaccine if Pfizer or Moderna is not available for my second dose? Generally speaking, we like to keep dose 1 and dose 2 with the same manufacturer. That's because we have data for that. We don't have data on switching vaccines. But then CDC also has a provision that if your site or your area runs out of vaccine, you can actually space out that second dose. Up to 6 weeks is okay. Longer than 6 weeks, they don't really recommend, but it is possible to space out that second dose if that has to happen.
Thank you, Dr. Kilgore. And then the last point that you made with respect to the vaccine is that the trials you mentioned to us, they were done in the appropriate way. There was time put into it. And so even though it looked like it was going really quick, there was really, the protocols were followed.
Absolutely. And one thing that people don't see is that we literally had thousands of people in the United States and around the world working on each one of these trials. Thousands. I know alone the number of investigators was in the hundreds. One of the things that also people should know is that we had oversight from a data safety monitoring board on all the trials. We have clinical monitors talking with us at the trial sites every day. They are looking at all of the data that we collect for everyone. And if there's anything even remotely out of place or out of line, they will call, they will email, and they will follow up. So all the data has to be triple checked, literally. And they can see everything on the computer. That is also true for the FDA. The FDA comes in and will inspect the data set that's used in the EUA and then also in the licensure down the road. The final thing I need to tell you is that the FDA does surprise spot inspections at the manufacturing facilities for these vaccines. The manufacturer may or may not know that the team from the FDA, the inspectors, is going to show up. and they will look at how the vaccines are being made physically. And if there's any problem, any missing link in the safety procedures, the FDA will write a letter, call them on the carpet, and the FDA will require that dereliction, or you could say mistake, to be fixed immediately. And if it's not, they will shut down that manufacturing facility.
Thank you, Dr. Kilgore. I just thought it was really important that we get those questions answered from our listeners, because they want to make sure that they can make the informed decision based upon some good facts. So thank you for being here with us, and we'll look forward to having you again. That leads us to the very important question about what's happening here in Flint, Genesee County, and what's the availability, what's the status, how do we get connected? And Sherelle, thank you for being here today. You already gave us a tip by giving us the phone number, but what else would you have us to know about how we can be clear about what we need to do to get the vaccine and where we need to go? Sherelle.
Hello, how is everyone today?
Great, great.
Do you have my slides?
Yes.
Okay. So I will just start off by giving some information today about where we are in Genesee County. As of March 8th, which was just a few days ago, the health department had administered about 19,538 first doses of COVID-19 vaccine, and we've had a return for second dose at a rate of 10,482. So we're doing well. And as you can see, the entire Genesee County has administered a total of 94,914 vaccines to the public. Next slide, please. So, speaking of efforts to get the vaccine, if you need it and have not received it, you can visit the health department at our two websites, either gchd.us. As soon as you get there, there's a button that says click here. You're going to click there and go to the blue box that says COVID-19 vaccine information. And there it'll take you to a link to pre-register for the vaccine. And you can also visit the county's website, which is gc4me.com. And that's the number 4, the word me.com. Right at the top of that web page is a link to get registered, and we are offering registration in English and Spanish. Once that information is put into the database, our epidemiologist then pulls that information and prioritize it by age and category in which you fall in based on the information that you gave us. And then we make those calls to schedule appointments. You can also click on the link or put the link that's on this slide into your web browser and register from there. Next slide, please. So again, we want everyone to know that we are taking requests on the daily. We're making those calls. We're reaching everyone that we can, all of those who have pre-registered. Since we've started this process, we are still prioritizing in categories such as phase 1A and 1B. There are some stragglers still from 1A that we're getting, such as our long-term care residents and staff and healthcare workers. We're also in phase 1B, which is our frontline first responders, our teachers and school staff, and those who are age 65 plus. And as of March 8th, earlier this week, Monday, we've opened up our vaccination efforts to those who are 50 plus with underlying medical conditions, or if you're 50 plus and you're caring for someone with a disability or children with special healthcare needs, the vaccination is open to you as well. Moving forward, after March 22nd, you won't have to have underlying conditions to get the vaccine at 50, but it will be open to 50 plus no matter what. So as you can see, the more that we reach our seniors and our phase 1A and 1B, we are slowly but surely opening up the categories to reach everyone. We do have to make sure that 75% of our senior population is vaccinated before the vaccine becomes available to everyone. Some of our points of dispensing sites include Flint Northwestern High School and Bishop Airport. Those two are one of our permanent drive-through sites for receiving your vaccine. And then we also have indoor sites stationed at Our Lady of Guadalupe Church, as well as Central Church of the Nazarene, Shiloh Missionary Baptist Church, the North Bank Center at U of M Flint, and coming soon, we will also have a clinic stationed at Mott Community College in the Event Center. And so I would like to let everyone know that although you've been vaccinated, it is still important to continue getting your test for COVID-19 vaccine. I'm sorry, for COVID-19. You want to make sure that you continue being tested because you could still be an asymptomatic carrier. And so you want to protect your family and those around you by continuing to get the test. There is a high efficacy rate in those vaccines, but there's still a small chance that you might pick up the virus. So testing is still something that needs to continue to happen. And on the screen, you can see where you can reach your testing locations. We have sites at Word of Life Church, as well as Bethel United Methodist Church and Macedonia Baptist Church. Other areas that are not state sponsored that you can receive a COVID-19 test include Rite Aid, Walgreens, and you can also go to Genesee Health Center to receive your test, as well as Hamilton Community Health Network. I also know that there are urgent cares in the area who also have rapid testing, like Genesee Urgent Care on Linden Road as well.
Thank you so much, Sherelle. We appreciate you bringing this information forward, because one of the things we do know is that it's important that we have these options, but it's equally important that we know that they're there and we can actually utilize them. And so we thank you for bringing this information forward. And I know you've been out there every day. Yes. That clinics are open, making sure that they're working right. So we appreciate that. As a result of the webinars, one of the things that we want to take a few moments to do is really today is hear from some of the voices of community. It is a result of these voices that have helped to give us some clarity about how to go from week to week and be sure that our community members are being heard. So we're going to ask now that we have some community members that are going to be sharing with us. Cheryl Thompson, William Dobb, and Maria Carruthers are going to share some information with us. So I want to first ask Cheryl Thompson if she can unmute herself. I know she's going to be unmuted, to share with us her perspective of how the webinars have been valuable to her.
Okay, thank you so much, Yvonne, and to all the panelists. One of the things I look forward every week to listening to what type of information may be shared with us as a community member. You give factual information and data from community and national experts. You share information and you answer questions, not only of what we need to know, but you'll answer questions of what we want to know, whether it's good, bad, or indifference. And for those of us who live in Flint, we know over the last few years, we've had so much misinformation that it's just very refreshing to make sure we get good information. And I know, Yvonne, that I've asked you to share something and you said, nope, because I don't have enough information about it. And that's very important to me because it's important that we have the correct information. But I think this group has been very thoughtful in sharing. And then this is a plug for Dr. Verholden. I was not going to get the vaccine. And so Dr. Kiergor, even the information that you share, because of all the mistrust and information, I wasn't convinced I was going to get the vaccine. Dr. Verholden, on one of them, you actually shared that you were also hesitant about getting the vaccine. But then you said that, and I don't remember exactly what you said, but whatever you said helped me change my mind. So I'm now vaccinated. And so it's those kind of things. You don't know how many people you've impacted, but it also impacted me. So I just want to thank each of you for being on this call and doing this webinar every single week. And I hope that you continue because it's information that we need to know. So thank you so much for everybody. Even Gary, I know you're on the phone call, and for the health department, you know, all of you who are regulars, I just really thank you for that.
Thank you so much, Cheryl. And this is unscripted. I didn't tell anybody what to say, and we just wanted to make sure we hear community voices. William Dobb, would you please join us?
And of course, I feel very honored that you asked me to sit in to speak to this very august group of panelists that you have. With good information, we make better decisions. The information that you have presented over the last 50 sessions of this webinar have been fantastic, informative, and thought-provoking. I've vaccinated twice, and as I mentioned, I am a COVID-19 survivor along with 7 other members of my family. Don't worry, it was not a super spreader event. It just happened over several different locations. I wanted to be sure that you knew that. But more important though, I had a very bad case of it. I was very fortunate that I had family support, because literally for 1 week, I could barely get out of where I'm sitting right here to move across the hallway to the bathroom. That's how personal it is. So the information came along to say, yeah, yes, I've had the virus. Yes, I have the antibodies. But at the same time, I also said I'm going to get vaccinated. Moderna ×2. Thank you to the Genesee County Health Department, and thank you to my agency, Genesee Health System, for taking a very active, proactive approach to getting the staff vaccinated, because we are first line treatment providers and service providers. The response here in Genesee County has been fantastic. You folks are outstanding, bar none. I wanted to thank you for all of that. Okay, so again. That's all I can say. Otherwise, I'll get talking way too much, way too emotional. But this has been a fantastic, I'm going to say a very enlightening process to going back and exploring what the new normal is for me and for my family as well. And thank you very, very much, Yvonne, for the opportunity. Thank you, panelists.
Thank you so much, William, for being willing to share, because we needed to know and do need to know, and continue to ask you as members of participating in this. Put your questions in the queue. The panelists are here to answer those questions for you. And again, thank you, William, for being one of our panelists for today. And the other person we want to ask to open up is Maria Carruthers. Maria Carruthers.
Good afternoon, panelists, and everybody else that's on this webinar today. I started when the HFRCC started, back when the COVID hit. I wasn't sure of what the whole thing was about. So I've been trying to be there almost every week for the information that the panelists provide, from everything from shots to how to handle your hand washing and things like that. And the clients that we serve in the community really appreciate the information you have given us. I have asked the moderator back in the day, in the summer, to provide the community health workers with CEUs. And if you're not familiar with CEUs, they are credit to continue on with certifications and things like that. So she wasn't sure, but she did finally pull it through for us. So thank you so much, Yvonne, for pulling that through to help us as CHWs to provide the information to the communities that we serve throughout the state and our city and county. It has advanced the careers of many CHWs with certifications requirements, and has given us, through the community, to provide that so valuable information you provide every week with us, with the information that is credible and up to date. I have been on several different other webinars, but there is none like this webinar. And I really want to say, on behalf of the CHWs throughout the state of Michigan, we appreciate you as the panelists and all the information you have provided to us. Thank you so much.
Thank you so much, Maria. And I will say that, yes, you got that whole ball rolling, but I honestly have to tell all of you, we've got a team in the background that is extraordinary. I serve as the moderator, but there's a hardworking group of persons behind the scenes that really make sure all of this happens. So I want to just say to you, community health workers, please continue to apply for those continuing education units because they are available for you. So we want to thank you, Cheryl, Maria, and William for sharing your perspective today. And let's keep sharing with our community members and families this opportunity for you to get information. If you send us information, it helps us to make sure we're getting the information that you need. In addition, because of community voices, we are now able to offer continuing education for social workers. It is very important for the social workers who are interested to register to attend the webinar through the Zoom so that you can be verified. We also ask you to enter your email address into the post-webinar. Please complete the post-webinar, and the School of Social Work will then reach out to you with your evaluation and for your certificate. So I want to thank you. A special shout out here to Susan Schneeberger, who helped us make the important link with Michigan State University's School of Social Work in order to ensure that these social work credits are provided. In addition, Gina Gimbel, who is tremendous in this work. She has also been very instrumental, and Mary Crawford. So please, if you're going to receive these social work credits, make sure that you stay on at the end and complete the post-survey form to get that information. Again, before we leave today, we've got more information. Dr. Deborah Verholden, you heard how valuable the information is that you share with this group. And I want to say, without your support and that of Michigan State University, and of course our other partners with University of Michigan, we would not have been able to do this. But your work at Michigan State University has been the tremendous shoulder in which a lot of this work has been led through. So let's hear what's happening with the policy brief, Dr. Deborah.
All right, y'all got me over here real moved. I had to turn my camera off and take a moment. I just really appreciate and want to underscore this is the power of partnership, you know, because you all are also the trusted, credible messengers in this community, and you touch people that we can't touch. So I just want to acknowledge you, Yvonne Lewis, for being the moderator with the most. And if people don't know, you do 8,000 miles of work every week, getting people together, getting people prepped and all of that. So Yvonne Lewis, we are here because of your unshakable will to make sure that our people have what they need. And I just acknowledge everybody for their partnership, and Yvonne for your leadership. So thank you, my friend.
Thank you.
And with that, we got to stay the course, folks. We got to stay the course. If you didn't know, we've had 5 consecutive weeks of increase in COVID cases in Flint. And we've got what I call the unacceptable, inexcusable can that we keep kicking down the road, which is bad data. We've got, you can see here, a bunch of our data are missing and unknown on race. That is the case in the state with vaccinations. When the COVID dashboard came out, 44% of the data were missing race, 70% were missing ethnicity. So we can't even say with certainty what the extent of inequity and who's actually getting this vaccine in their arm is. I think it's deplorable, disgusting, and unacceptable. We are doing everything that we can, and we just thank you all for your continued partnership. So you have the the community case rate right now in Genesee County is 5.8%. We were below 3% 5 weeks ago. We're now at 5.8%. So this is not the time, people, to take your foot off the gas. We got to stay the course, continue to honor those protocols. I don't tell people to get the vaccine. You got to make that decision for yourself. But please lean on these trusted, credible messengers who want nothing more than to give you all the information you need to make an informed choice to protect and preserve the health of not just you, but your loved ones, the people you come in contact with, and the people in your community. Next slide, Tay. We have launched what's called Mandate Equity. We're calling on our elected leaders. Legislators make laws. We have no laws requiring equity in this vaccine. And President Biden came out last night and said they're planning on opening up eligibility for everybody by May 1. I'm not okay with that. Until all of our grandmothers, until all of our aunts and uncles with hypertension and diabetes, until all of our teachers and all of our frontline workers who said they want the vaccine have gotten it, I'm not okay with it being opened up. And the rest of us are just going to have to wait our turn. So Mandate Equity is a movement to get legislators to do what legislators were elected to do, which is make laws and get executives to do what executives were designed to do, which is to enforce those laws. Check it out, www.mandateequity.org. Because Yvonne Lewis starts on time and ends on time, I'm gonna close us out and say, like us on Facebook, subscribe to the YouTube channel, that beautiful tribute video, which we could make a longer one, because if I could, the tribute video would be about 8 hours long to tell you all thank you and how much we love you. But do please like and subscribe to the YouTube channel. Go in YouTube, click Healthy Flint. We have our own dedicated URL in YouTube right now. It is Healthy Flint. Email any questions, info@hfrcc.org. And Yvonne and her team, our community core of the HFRCC, mans a phone, 810-835-2130. We are here. We are happy to be your partners and happy to be of service. And we will see you next week. Yvonne, you get the last word.
Thank you, Dr. Deborah. And words cannot express our appreciation for you, the community, because it's our goal that you get the best information. Help us by continue to ask those questions, and please hold us accountable. We are in this together. More to come. See you next week.